Hi, everyone, and welcome to the Women and Girls Foundation's web show, In the Movement. I'm your host, Camila Rivera-Tinsley, and each month I interview incredible people who are working towards creating a more sustainable and equitable future, with our conversations focused on gender, racial, and environmental justice. And this month, I'm honored and thrilled to have my special guest, Amanda Neatrour, join me. Amanda, thank you so much for being here.
Thank you so much for having me. I'm really excited about today's topic.
Yeah, and today we're going to be talking about things that are right in your wheelhouse. We're going to be talking about mental health access and the intersection of mental health access and Black identity. So thank you so much for joining us. You have such an amazing background. You are a Sheridan resident, you're a small business owner, you're a caregiver and a mom, and you're also running for Pittsburgh City Council District Number 2. Can you talk about what led you to your decision to run for council?
So when I decided to run for city council, it was just on the basis of the fact that I knew very few people had my experience and my background. Politics is not something I ever thought I would ever get into. However, when the opportunity came up and there was an open seat, meaning that the person who's there now decided not to run again, the opportunity sort of presented itself. Uh, and when I talk about my background and experience, I'm talking about the fact that I had worked for the city of Pittsburgh, that I had actually worked with and trained the workforce on um, the Americans with Disabilities Act overview on not just the legislation, but also what it means to create an intersectional workforce. And this is work that I have done and facilitated trainings and workshops in workforce within communities across gender, across race, across disability, across ageism. You name it, I've done this work. And also as a disabled Black woman, as you said, I am a caregiver. I am the caregiver to my mom who has Alzheimer's. I'm also a mother to two beautiful boys. And so all of those experiences with being a homeowner, with being a small business owner, and having to navigate these systems, I wanted to bring my leadership experience, having been chair of the Equity Commission for Pittsburgh, having been the chair of the Aging Subcommittee on the Governor's Advisory Commission on Women. I, I knew that I could make a difference in helping local government to really center the needs of the folks who have been typically overlooked. And I want to name also the LGBTQIA plus community in that as well, and trans individuals. So, I mean, you really name it, all those intersections I've worked with alongside, and that was really the main impetus for deciding to run. And I'm glad I did it. It was a wonderful experience. Unfortunately, I did end up having to finish my run as a writing candidate. This being my first time running for office, there's a lot of things I didn't know about the process, but I learned a lot and I got to get my message out there. I got to show people what it means to fight for your community. And it's something that I'm really proud that I did.
I am so proud that you did that as well. I mean, I definitely admire people who take risks and people who advocate for themselves and for the community. And that's really what the Women and Girls Foundation is all about. And I think it would be so amazing for you to be able to share what you've learned from that experience with other people that want to, run for office or that are curious. It takes a big, huge risk to do that. And I am looking forward to you taking more of those risks and to me supporting you in doing that.
Thank you.
So you mentioned all of those amazing lived experiences, and it's so important to be able to share those lived experiences. One of the things that that you are known for and have been very outspoken about is disability justice. So can you talk a little bit about why disability justice is so important to you?
Yes. So first of all, as a Black woman living with several disabilities, navigating the world, navigating the healthcare system, navigating just every institution, it just becomes more and more clear how little the experiences of folks who are disabled are ever considered. And I always like to name the fact that I call myself disabled, not because there's anything wrong with me, but because I live in a world that is not accessible to me, that is not inclusive of people who, are not, quote, typical, or even just the fact that most of us, even people who are not diagnosed, are asked to mask. And when I talk about masking, as a person who was diagnosed with autism late in life, as happens with a lot of women, especially women of color, especially Black women. There's a specific thought with masking when it comes to being autistic. However, you can talk about masking in terms of having mental health disabilities or having mental health challenges or having even temporary mental health crises. The fact that we're asked and in many ways demanded of us that we show up and pretend like there's nothing wrong, there's nothing happening, that in itself is a type of masking, which actually causes great harm. And so we live in a world, in a society where instead of creating supports and systems and institutions for people, to be healthy, to be well, including mentally and emotionally, instead, we necessitate folks pretending like everything is okay, no matter what is happening to them, no matter what is happening around them. And so being someone who is living through it, who was diagnosed many years ago with depressive anxiety and PTSD, uh, having to navigate that as a college student, having to navigate that as an employee, having to find a way to support team members when I was a supervisor. What does it look like for me to be mindful and intentional of the staff that I'm in charge of, caring for when the institutions that I'm working with don't have pieces built into them? And that includes when I was the director of the Women's Leadership and Mentorship Program at RMU. What does it mean to support these incredible student women leaders and telling them how important their mental and emotional health is and self-care is when those are not the messages they're getting from the outside world? That in leadership, you need to care for yourself, and leaders who understand caring for themselves can care for others. So I know that you asked me about why this is important to me, but this is something, disability justice is something that I live with and think about every single day because I see the battles that people face every day, including my own. And we all have the potential to be disabled at any point, which means that it's something that affects everyone. And until we have true justice for people with disabilities, at the end of the day, no one will have justice for themselves or the people that they care for.
Well said, well said. So you talk about some of these systems and these barriers and the messages that women and women of color in particular are receiving. Can you give me some specific examples of some of those systemic pieces that are kind of working at odds for Black women?
Absolutely. So, the first thing that comes to mind is the trope of the angry Black woman. So, some key things that I've learned, again, in navigating my own life, my own challenges, but also what it means for me to teach people about the unique ways that things like PTSD, anxiety, depression, how they actually show up differently with different individuals. Black women are often made to show up, to be strong, to be resilient, not just because of what they face, but we're not given the grace to be emotional, to show up authentically, as angry, as tired, as confused, right? Having that anxiety. And so it actually can sometimes show up differently. So people who call us angry, what it is that's our frustration manifesting. But because we're not really allowed to show our full range of emotions, because of the systemic racism and misogyny that we live within, calling that misogynoir, right? When you have the intersection of misogyny and anti-Black racism. So Black women are called angry when they're expressing frustration, whether it's in the workplace, whether they're seeking treatment, even in relationships. That is just one clear example of a cultural barrier that Black women face, which again exacerbates the challenges they're already facing in their own mental health crises. When you do try to seek help, or you do try to share your frustrations or your anger, or that you're actually told, "Oh, this is too much for us." And then, of course, just thinking about too, when it comes to mental health specifically, I know that I talk a lot about the challenges that I face finding providers.
Mhm.
So, number one, finding a mental health care specialist who understands the nuances of being a Black woman living in our society and the different things that I face. Also, being autistic. So, having that real anxiety of, okay, I'm going to go seek mental help from this person, but do they get me? Do they understand me? Are they going to gaslight me? Are they going to blame me for the way that I'm treated when it's a result of systemic racism? And then, of course, the financial barriers. We still have insurances that don't fully cover mental health access. Mental health and emotional health is still not seen as being as important as, quote, physical health, right? The physical body. So we have all of these barriers, the stigma against mental health and emotional health, the stigma against disability, the stigma against having a full range of emotion as a Black woman. I mean, you name it, it literally permeates in every single facet of our society. And even conversations like this, we're having them more, but they're still so far few between.
Yes, yes. And as you were talking, of course, I'm thinking about some of my own personal journeys, but I'm thinking about organizationally, things that WGF is working on. So in particular, you talk about the workplace and you talk about some of these systemic issues and how we have to show up. And it makes me think of the Level Up Pay Equity campaign. Um,
Yes.
and that is something that WGF works on with YWCA and was really led by the Black Women's Policy Center. And those conversations that we have with one another about advocating for a workplace that understands and sort of gets these issues and creates a culture where we feel more accepted. I mean, I think that that hits right home in that space. And while we're talking about that, I also want to lift up because you're a key piece in a lot of these conversations. You also work with us in having access to paid family and medical leave. So the Family Care Act, which right now there's a lot of intense conversation in Harrisburg about getting that particular bill passed and making sure, when I think about that, I think about what would it be like for Black women and all individuals to be
Mm-hmm.
able to have access to um, being able to have paid leave so that they can take care of their family members that are struggling with autism or struggling with disability, or if I'm struggling with my own mental health. So I just really felt like it was important to lift those up, especially since you are such a leader in those conversations and in those political spaces. Can you talk about some specific initiatives that you're working on or specific things that our constituents should know about?
Yes. So probably most recently, I worked with the FISA Foundation, who put out a report looking at disability in the healthcare system. That was a report that actually dropped about a year ago. And I was really fortunate to be one of the folks who was interviewed for this and also a recommender for making sure that the report really centered folks with disabilities and our very vast and intersectional experiences and really being about us, not people talking about us, but really centering our voices and experiences. I'm very proud of that work. I'm very proud of participating in that work. I'm so grateful to the FISA Foundation and how intentional they continue to be to raise those voices. That's just one piece. I actually also had the chance to be on a panel hosted by your organization a few months ago, where I got to sit with two other really incredible women in the disability justice space that I greatly admire. One of them being Dr. Josie Badger, who I just absolutely adore. And again, speaking very frankly and openly about what it is like and what we need to do, what is necessary for us to do. And I'd be remiss if I didn't raise the very real fight happening right now at nationally around Medicare and Medicaid.
Mhm.
And the threats that we're facing to cutting those critical programs. We do not have enough funding as it is for general health care, let alone rolling back. And the people who are most affected are those who are most vulnerable, including people with disabilities that are already so restricted in terms of just being able to participate in society, to live, to survive, and to be cared for. So this fight really is a fight for survival. And that's important too. And also, I just recently, I was now former Mrs. Pennsylvania American 2024, and I mention that because I had the wonderful opportunity to begin to partner with the Ms. Wheelchair Pennsylvania America organization, who I'll be volunteering with in September for their upcoming competition to crown the next Ms. Wheelchair Pennsylvania America. And I I talk about them because there's so many different organizations that are doing work in this space. Disability justice is just as much protesting in the nation's capital to demand that we give funding and give care and consider the barriers facing disabled folks, but it's also about lifting up and raising up our leaders who are living with disabilities, who are going out there as ambassadors and inspiring people. So this is just some of the things that I've been able to do just in the last year. Um, However, every day, every time I'm in a space where I get to speak, I'm always intentional about raising the fact that we have to talk about disabilities. We have to talk about gender and disabilities. We have to talk about these things. So if someone else isn't talking about it, I'm going to bring it to the table.
Well, I'm so thankful for that. And our show is very short. We only have about 15 minutes or so
Yeah.
to talk about these important issues. But I think this is just the beginning for folks that are not aware or who are just starting to think about how these issues impact them and the world around them. This is a great starting point. And I hope that we can continue conversations like this in the future. I'm really looking forward to that.
I would love to. And thank you again so much for this. This is so important.
Yeah, absolutely. Now, before we wrap things up, I also want to make sure that we lift up, you have your own small business. So tell us a little bit about your small business, what it's about, and also how can people find you and stay connected to all the work that you're immersed in?
Oh, thank you. Yes. So Lewis Neatrour Group, it's a full service consulting firm. So we support leadership and organizational development for sustainability and transformational change. So I do everything from coaching to consulting to training. I actually just facilitated a restorative practices workshop for a social justice centered organization, which what I love about this workshop is that the people who do this work, such as yourself, we often don't talk about the necessity of our own mental health and our own self care in doing this work on behalf of others and moving the needle for our entire society, if we're being honest, right? And so, just a little bit of what I do, but people can go to lewisneatrour.com. That is my firm's website. I'm also on LinkedIn. I'm on Facebook. I'm on Instagram. I'm all over social media, Blue Sky. So yes, please get connected, reach out to me. And I'm always happy to continue to support efforts like this.